I'd like to call to order this meeting of the Cunningham Township Board for Monday, August 14th, 2023. Will the clerk please call the roll?
Ms. Wu,
Here.
Mr. Evans,
Here.
Ms. Hersey,
Here.
Ms. Colacetti,
Here.
Ms. Bishop,
Here.
Ms. Wilkin, Mr. Quisenberry,
Here.
Mayor Marlin,
Here.
Ms. Chenoweth. Ms. Chenoweth, are you here? Okay. Ms. Owana.
We have a quorum. Next item is approval of minutes from the June 12th, 2023 public hearing and the June 12th, 2023 meeting, board meeting. Is there a motion? Mary Alice?
Second.
Moved by Mary Alice, seconded by Chandra. Any substantive corrections? Seeing none, all those in favor, please say aye.
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 All those opposed, same sign. That motion passes. Are there any additions to the agenda? No additions. Next item is public participation. There's no public present at this meeting. We'll move on to the committee to verify bills. Town Fund and General Assistance Fund.
Greetings. Okay, so as you all know, we did not meet in July, so you'll see two sets of bills in this packet. In the supervisor's memo, I've actually broken them out by month, just so it's easy to see what were June expenditures and what were July expenditures. And typically expenditures go from town board meeting to town board meeting, so that's the duration. So in the town fund in June, we had expenditures of $64,695. And then in July, we had $59,981.68. In the general assistance fund, our June expenditures were $117,688.28. And our July expenditures were $159,874.19. So our totals for June is $182,383.28, and in July is $219,855.87. I'm happy to answer any questions first, just around the bills.
Any questions?
And, yeah, so I guess we'll get to the supervisor's memo in a second. I'll go ahead and let you.
Okay,
From the
we
bills.
will need a motion we'll do them by month, so from the June 6th through July 3rd bills, is there a motion to approve?
I'll move approval.
Okay,
A second.
moved by Mary Alice, seconded by Jaya. Any discussion? Will the clerk please call the roll?
Ms. Wu,
Yes.
Mr. Evans,
Yes.
Ms. Hersey,
Yes.
Ms. Colacetti,
Yes.
Ms. Bishop,
Yes.
Mr. Quisenberry.
Yes.
That motion passes. Now for the July 4th through August 4th bills, is there a motion to approve?
I'll move approval.
Second.
Moved by Chandra, seconded by Mary Alice. Is there any discussion? Okay. Will the clerk please call the roll?
Ms. Wu,
Yes.
Mr. Evans,
Yes.
Ms. Hersey,
Yes.
Ms. Colacetti,
Yes.
Ms. Bishop,
Yes.
Mr. Quisenberry.
Yes.
That motion passes. Moving on to reports of officers.
Yeah, so if you go to the supervisor's memo, the staff, so each of the staff leads submits their report each month, so I just had them do June and then do July. So we saw a slight increase in general assistance participants, up 5. We continue to work on homeless numbers. So we're at 11 homeless, which is actually great if you look at the larger history of our general assistance participants. But we did, this last week, did an extensive 5-day call through of our largest list, like as many participants as possible, including all of our general assistance participants. for the housing choice voucher opportunity. I don't have the data yet from that because we just finished end of day Friday, but I'll put that in next month's report. But essentially, we really pushed hard on that piece. There is going to be an opening of mainstream vouchers for people with disabilities, so we'll also do an intensive push. So essentially, but that will help with some of the homeless issues. We did, we're case managing the 25 units at Pinewood. Many of the folks are our participants, and they are full. So just looking at what are our other options for housing, and I certainly think that Hope Village is a really important opportunity for our participants. The participants who will be staying at Hope Village are the medically fragile participants who have been chronically homeless. And frankly, I don't know where people got their perceptions of the homeless, but I work with the homeless every single day, and I can tell you that the people who will be staying at Hope Village are extremely vulnerable folks who have disabilities, who need a place to lay their head and be safe. So the homeless are actually in the least safe category of individuals. They're not predators. They tend to be the folks who are actually escaping predation, are oftentimes victimized, and they, especially the chronically homeless, they've been homeless for a while, and so their life expectancy is 20 years less than the average resident. So I just want to debunk some of what I've heard around homeless participants. I really think it's important for us to ground in the reality of who will be served, and it will be our general assistance participants. We know them very well. We know their situations, and oftentimes they're just trying to get by. So you can see information about our disability and wellness track. In particular, we went a little bit deeper in terms of our SOAR support. It's a really important piece of the work that we do is to help people apply for disability. We started off with Rosecrans being the only agency in town, including any lawyer. There's no lawyer that will help you apply for disability in this town. So Rosecrans was the only person you had to be a participant with them. We added our SOAR track, and we've worked with Champaign County Healthcare Consumers, and I think you all approved some dollars that would help to support their SOAR. I just want to say that's a really important piece of the equation, is helping people with a good beginning application for disability. It just speeds up that process so much. So you'll see some of the data in terms of our success rate. It's a long process, but it's important for us to continue to support people in that way. You will see that our Housing First payments are going really well. I would say it's one of our most successful programs in terms of stabilizing people in their housing. So once people get into subsidized housing, making sure that they stay on top of their rent and utilities and providing support if they don't. And then you will see rental assistance. Thankfully, we've received support from the city of Urbana and could provide expanded rental assistance. So I just gave you some historic numbers. We went from 26 applications in April to 56 in May, 60 in June, and 65 in July. We did spend over on rental assistance last year. As you'll see when we get to the budget, we spent under on general assistance. We still went under in our budget as a whole and in our assistance budget, but that was where the need was this last year, and we've certainly increased the budget this coming year. So we increased it from 125 last year to 178K this year. We've helped 137 households move in to subsidized housing, so we just keep on that track, and we're hoping to really see a big influx once the housing choice voucher applications start flowing again. So we're excited about that piece. Let's see, I know there have been some questions about our street outreach because now Strides has street outreach, we have street outreach. And there is some Salvation Army street outreach. So recently the Continuum put together kind of a guide that explains all the different pieces of street outreach. And we're working with Strides to really align so that since they have overnight staff and we have daytime staff, we'll be meeting next month to talk about our street outreach and kind of get in our lanes and try to avoid duplication of services so that we can provide we're not quite to 24/7, 7 days a week, but we're close, and that's really exciting. So I'd like to get to the point where we have 24/7 street outreach for police officers to call, for residents to call. We're not quite there yet, but we're building, and I would say within this calendar year, or within this fiscal year, we'll get there. The community shelters do remain full most nights for both men and women. See You at Home, as you know, is moving men from 70 East Washington Street to 410 West Springfield. I will be there at the event on Thursday, and I can't speak enough to how important that move is, because it allows the low barrier shelter to have more beds on location at that appropriate location. And frankly, it allows folks who are seeking sobriety and are really doing intensive case management to have those supportive services on site and to be in a more home-like environment. So really excited about that. I feel like that is a major piece of moving forward on homeless services, and I want to applaud the city council for supporting both of those. And the city council and the mayor. The utility support, I've said a lot about this, and I just want to say we've diverted HHI funds, so those are home ARP dollars, as homeless prevention dollars to do utility assistance. We literally would have run out of all of our angel donor funds if we had used angel donors. So thanks to that grant, we've been able to really we haven't had to turn anyone away who is an Urbana resident with an active shutoff. So that's super. An active shutoff who's not been assisted in the last year. Those are our rules, very simple. Our digital, we just got a grant in with UC2B as the nonprofit partner and the U of I Community Data Clinic, and we're looking forward to DCO Digital Equity Kickstarter Program grant that would allow us to do laptop distribution and digital navigation training. This builds on 2 years of work with the Community Data Clinic in this area. Actually 3 years of work. And I think let me see if there was anything else. I had our food assistance case manager really give a lot more details around the food assistance, because we've seen such an increase in that. So you can even see, we got 17 referrals from Carl and Pace. We started doing pet food, which is all the pet food comes from the University of Illinois Extension Services. What is CMF? It's some animal services at the University of Illinois provides our pet food. So that's been great. And we, since June of this year, we served 227 households. So during the time frame that we're reporting on these 2 months, we've served 227 households just with food deliveries and door service. And then of course we have guides and other things that we provide. And then I have some really great pictures from our self-care fair, which was in July. We just had our back to school festival yesterday, and we had about 120 people there, and they got to go swimming for free with our partnership with the Park District. So that was super fun. And I did want to just raise to you, you might have seen this in the News Gazette, but essentially I had written a letter with significant concerns about the DMV being appointment only. They responded and said, no, we're not appointment only. You can have walk-ins. We tested, and that absolutely was the case. We've been able to walk into the DMV. And then suddenly, out of the blue, we got a press release saying that they were going to appointment only September 1st. I would encourage you to contact the SOS, and I even gave information about how you could do that. There's a telephone number and a website. It really is important. People don't understand this, who are middle-class folks don't understand this. I work with people who don't know what time of day it is. They think it's September. They don't know where they are. They don't have shoes on their feet. They are dealing with mental health crises and substance abuse crises and others, and they cannot apply for vouchers and cannot get a voucher without a valid driver's license. And their things are stolen on a regular basis on the street, right? And we're working with 40 people who are not staying in the shelter with a lockbox who are on the street right now, 40 active folks. So when we find them, we need to drive them to the DMV, and they need to take them and serve them because they are citizens and residents of this community. And instead, they're asking us to do appointments, and the DMV is empty. And if you go over there, you will see it. It is empty. So we built a beautiful facility. That's the reason that they wanted to move. It's one of the reasons they wanted to move is have a bigger facility. That facility is empty. You can see in my letter a picture of the empty facility on a morning. It was not the first thing in the morning. It was mid-morning. That is a picture of the DMV. There is not a single person in those chairs. So I would encourage you as elected officials to speak to our new Secretary of State and let him know that not everyone is in a position to make an appointment and is able to kind of track time in that way. And in particular, seniors, people with disabilities, and homeless residents need walk-in access to their DMV. They should not have to drive to Rantoul. That is my report.
Questions of Danielle? Sharice?
Danielle, I don't have a question, but I do have a comment, especially regarding the DMV issue, because it's the community that you're talking about, but it's also, like you said, seniors and other people, and it is not the easiest way to do that. It is not the most efficient way to do that, even. And I have written to the
Thank you.
Secretary of State.
I appreciate that.
Regarding how, what an awful way that is. And I did have to go to Rantoul to renew my driver's license. So people do need to take into consideration the fact that my issue is I'm a caregiver. So from one day to the next, it's an adventure. And making an appointment is not always available to me. So, if you have to get something renewed, if you have to get an address, if you have to have it by a deadline, the way that it is online is totally inefficient. So I agree with you on that, and I thank you for bringing that up.
Thank you.
Any other comments, questions? All right, Ivana, did you have a report this month?
Nope, no further report.
Nice to see you, though, in person. We'll move on to unfinished business. There is none. New business.
Okay, let me make sure I get the right budget. So we're doing, so this is, as you recall, it was quite some time ago because it was at the beginning of the summer. You put the draft budget on file for fiscal year 2024 and held a public hearing at that time. And so it's actually been on file about 3 months. The reason for the delay is twofold. Once we've canceled July because it was difficult to schedule with the town board and council. The second is because we've been waiting to hear back on several grants. And it actually makes our lives a whole lot easier to have actual numbers from those grants. So we have heard back. And what you will see in your packet is, if you just go to the budget itself, there's quite a bit of narrative. I put all that narrative in there because I think the public should know. And so there's a lot there about community need, about our programs and who we serve and how we serve them, how many we served, et cetera. But there's one section which is on the budget. It outlines our grants. Okay, so it is page 12 of the budget, which in your PDF is page 65, in case you want to follow along. So essentially, you've been following this trajectory. We put forward a plan for expansion for our Bridge to Home program. First, we raised tax levy, and you helped with that. And so we were able to restore our general assistance fund, and we were also able to add to the tax levy. So approximately $300,000 and $300,000 a year, right, to restore the fund and then also to support Bridge to Home. So that really supported our kind of small version at the apartment units. We purchased the 2 properties. We've been really looking to develop a continuum all the way from street and school outreach to 12 months in permanent housing so that there's really a continuity of care. That's been our big picture. And we do our part, and then we work with partners to layer services, legal services, immigration services, disability services, medical services, rape crisis, domestic violence, all of it layered on top. So essentially, we put forward a plan for growth, which was in our ARPA grant. You saw a version of it there. A plan for growth and how it was going to be funded. And basically, I'm happy to say we have completely fundraised for the growth that we wanted to see. And so we've raised $2,479,275 since November, including $1.9 million approximately in time-bound funding. That would be the city and county ARPAs, HHI, and this is important, $655,331 in funding that's eligible for renewals, and those are state. We got a emergency housing, transitional housing grant. We were funded at the full amount of that we requested of $530,000. And that is most likely will be renewed. So they put it out because the state really put a lot of money in that basket this year. They let us know that it was likely that if we applied this year, we would be renewed for 3 years. So no guarantees, but if we, manage it properly, I think we're good. So with the Emergency Solutions Grant and that, we're really at another $700,000, approximately $700,000. And that is really key to maintaining. So you had asked during the city ARPA project, how are you planning on? And I said, I'm sure I and everyone else was like, we will raise grants. Well, I was serious. We are going to raise grants. We did raise those dollars in grants. And so we're able to do those one-time bricks and mortar pieces. So we have already gone from 11 FTE to 13 FTE. That means full-time equivalent. We plan to go to 14 and a half this year. And we also have a number of contracted support with area agencies. So that's one piece, is just going from the 11 to 14 and a half. And then the second piece is going to be expanding our office and adding hard units. So for this next year with the EHTH grant, we will be operating between our 8 units and our hotel and landlord partners, 22 units of housing, which is very exciting. So that's the kind of big picture, and the budget reflects that. The town fund budget is much more boring on the supervisor side. It's basically exactly what you did last year. You'll see that the growth in the supervisor's fund, I think was, growth in supervisor's fund was 4.34%. So it was primarily in a staff increase and benefits increase. And then I did put I put in some dollars specifically around accessibility in our garden and in our office. But not much change there in terms of supervisor. The general assistance fund, which is really the sole authority of the supervisor. So that's how the form of government works with township, is that I get to call the shots on the general assistance budget. That said, I really like to provide the public, which is paying for this, whether through the state or through local, all the information about how their money is being spent and our plans for growth. So I'm happy to answer any questions, but my budget narrative is very extensive. It's a good nighttime read. It's got a lot of information in it. It has a timeline of our growth from 2016 to date. And I encourage you to have a good time reading it. I'm happy to answer any questions on my side.
Questions? Just for clarification, Danielle, the Cunningham Township final budget that is in the packet, is that the revised budget?
So what you'll see is the 2024 budget, there's the narrative, and then I think the actual one-pager was left off, and so I sent it to the town board. So that is that's the budget that, maybe it got updated. That's the budget that has the DCO grant in it. So those are the numbers that we're looking at. I should have mentioned, we got $500,000 from DCO, and I'm running it through the town fund, because part of it might be for office. So I thought it would be best from a statutory perspective to run it through the supervisor's fund. And we don't have a grant agreement. We've just been written into the budget for that $500,000. So I put 400,000 in property acquisition, and 100,000 in renovations. So if you're asking for where is the fiscal year 24 budget, I sent a copy to the town board on Friday, the numbers portion.
Okay.
Yep.
All right. So first item of business is ordinance T 2023-08-002, which is an ordinance approving the Cunningham Township annual budget for fiscal year 2024.
I'll move approval of ordinance number T-2023-08-002, and ordinance approving the Cunningham Township annual budget for FY 2024.
Moved by Chandra. Is there a second?
A second.
Seconded by Jaya. Discussion. Mary Alice.
I was hoping that the assessor could talk a little bit about the 19% increase in the salaries proposed in terms of the salary compensation plan.
Yeah, so as I mentioned during the briefing that we had for the draft of the budget, we are going to be having a lot of employment changes, seeing as that I had to become the assessor. We've also had to kind of move everyone else around who was my colleague as well. So in addition to 2 more people coming on full-time, whereas they are part-time, or as they were part-time during the fiscal year 23 budget, we'll be adding those 2 people on, one as my chief deputy, which is basically second in command. That's what I was prior to becoming the assessor. And the other is going to be a junior data scientist, which basically, due to that particular position, his skill set, and also within, sorry, I'm trying to explain this specifically, within the context of his immigration visa, we have to meet a specific level of pay, and it has to be salaried. So in order to meet those 2 particular employment requirements that we're going to be moving into, as well as allowing for 2 people to still remain on staff part-time, and then the person who is in the office with me currently to remain full-time, Jada. That is what is required to keep us competitive in our salary offerings, as it is very difficult to acquire skilled professionals who are in the property tax industry for small and medium jurisdictions such as ours. It's a lot easier to get them in Cook County, but here it's not quite the case. And especially considering that I am as young as I am in my assessorship, I need that level of education around me in order to run our office efficiently. So that is the reason for the increase.
So can you speak to the FTE? You kind of itemized each individual, but the FTE from last year to this year?
I'm sorry, the what?
The full-time equivalent number of staff members you have that are 40 hours a week from last year to this year. Have you increased the number of FTE?
Yes, that's what I was saying. So for fiscal year 24, we're going to have 4 people who are on full-time. That is including myself. So I suppose 3 full-time employees who will be in the office starting during fiscal year 24. In addition to that, we will also have 2 part-time employees who will be working predominantly remotely, but will have the opportunity to come into the office as needed.
So let me rephrase, I'm sorry, perhaps
Yes.
I wasn't clear. So when Wayne was in the assessor and you were the deputy, how many other people did you have in the office at full-time equivalent? Did you only have 2? Or I'm trying to assess if under Wayne's direction, how many FTE you had, and now under your direction, how many FTE you have?
2, including myself, when Wayne was the assessor, and now it's going to be 3, not including myself, because I am the assessor.
Right. All right, so 2 including yourself.
Including myself when I was the deputy, when Wayne was the
Okay, so
assessor.
you've increased by 1 FTE. Is that right?
Technically 2, because I've moved into the assessorship position, so it's a new person who is going to be that second and third employees who are full-time, if that makes sense. So previously, it was me and Jada. Now it's going to be Jada, Tanmay, and Kara.
Okay, all right, so you've increased by 2 FTE.
Yes.
some reason, I always thought that there were 4 total FTE. We've had this conversation when Wayne was here.
There were at some point, but not when I was the chief deputy, which was within the last calendar year.
All right, thank you.
James?
Yeah, so quick question. You mentioned that in order to retain an employee, I assume that is here on a visa, that we have to pay the prevailing wage for that job?
Yes.
And that's what's driving that. Does this budget have funding in it for supporting that employee's progression or renewal, progression towards permanent residence or renewal of their current visa?
Renewal of their current visa, yes, because this actually is a renewal of the visa that they had previously. They were on I shouldn't say it was the specific visa, but they were here on a work visa previously when they were a student at the university in concurrence to working at our office. And now that they are becoming a full-time employee and they will no longer be a student at the university they are attending before the end of this fiscal year 24, we are sponsoring this renewal.
Was that previously like a training visa?
I couldn't tell you because I was an intern when that happened.
So we're going to move them to H-1B?
H-1B, that's correct.
For the future?
That is correct,
We
is
don't
what
know
we're
they
going
were
through right
before.
now. Correct.
And do you know if we have plans to support them in pursuing permanent residence?
I do not know at this time, as we are just moving through this H-1B process, and I have not had the opportunity to speak with them about that yet.
All right, thank you.
Any other questions? Jaya?
So this is for Danielle. It's more of a request for kind of fine tuning language. I lost the spot, but you have the statistics about who tends to be impacted by homelessness, and you mentioned that women are disproportionately and even more so trans folks. And I would just ask to clarify that, because it says trans folks experience homelessness at higher rates than women, to clarify that that's cis women, because trans women are women.
Yeah, it's trans, yeah, folks who identify both as women and trans.
Right, I understand that, but it just says that I'm trying to find the page, because it is phrased in such a way that would suggest that women and trans folks are two separate populations, and that's not accurate. So, and I know you know that, but just asking for that clarification for more inclusive language.
Okay.
Chris?
Yeah, this is a question for Danielle. Probably the most disappointing part of your report that you have no control over is the difficulty it has been to get the Social Security Administration to process applications for disability and SSI. Champaign County Healthcare Consumers, of course, applied for ARPA money to bolster their staffing to help apply. And I guess my question or my concern is are we going to be able to solve the problem of not having adequate legal services to make appeals? And, could you maybe address that issue?
Can we solve the issue? I don't know. What we're doing is we hired a SOAR case manager and trained them. We had a SOAR cohort of 8 different organizations in town who we helped to train and bought them pizza and croissants and helped them train in this. And we are part of, and some of them decided to and we helped to work with the mental health board to provide funding for case managers in the community. We continue to have that cohort. It's smaller than I would like it to be, so it's now only 3 organizations, and then there's some that don't use the SOAR process but come and go and do some support. The next frontier, just in fiscal year 24, is that we are bringing in interns for the fall, so doing a lot of outreach in the next month. I've reached out to urban planning staff. I've reached out to our social work staff. I really would like to develop a relationship with the U of I Law Clinic, because I would like to have an intern who specifically helps to support this area, who may be interested in going into disability services in their future. So that's an area of growth that I'd like to see. And I continue to message how important this need is because on the one hand, SSI does not even pay poverty level, and that's a problem. The other thing I'll say is, okay, so that's what we can do. I spoke before the Illinois legislature on this, and they're actually very interested in it, and I'd like to go back. I'm going to be at the Housing Action Illinois Conference in October, and I'll speak with them again. But there are a number of states that augment Social Security payments from the federal government with state payments that bring the amount up out of it being this basically, if you are on SSI, you can't afford independent housing in this town unless you have a housing subsidy. So the whole goal is, could you get the amount that people receive in SSI up high enough that they could at least afford a studio or a one-bedroom apartment? That would be a big difference for them. The other thing I'll point you to is that you'll see SSI, so our county really hasn't grown much, but the number of people on SSI has grown who are considered disabled. SSI and SSDI has grown in the county. And it's not a sharp increase. I can't say, oh, it's us because we've been helping people get on SSI. I'm sure we've helped, right? But if we looked over a longer horizon, we looked over a 10-year horizon, and you'll see the graphic in the packet, that there has been a gentle rise in the number of people on disability. And I think that has a lot to do with high cancer rates, pollution in the environment, trauma, all kinds of things, poor health outcomes for folks, major public health issues in terms of access to healthy food, et cetera. So these all kind of contribute to a rise in disability cases, people with disabilities in the community. So I would urge, our local leaders to really pay attention to that piece and make sure that the resources are available so that people don't experience homelessness or housing precarity. And I will tell you, and I've asked for this report to be run, and maybe we'll get it in the next year or two. I've asked for our local homeless shelter, in this case it would be Strides, to just when you do an intake, see who has a disability and who is on SSI. It's amazing how many people are in our shelters who get SSI payments. They get SSI payments. And so they have the income that they're going to have, but they are not able to get into housing. That's a real issue.
And SSI is around $700 a month, right?
It's I want to say it's $813 or $831. I'd have to look it up. It is it's $914. In 2023, $914. Actually, the last 2 years, they've had bigger bumps than before, partly because of inflation.
Sharice.
Well, let Chandra go first, but she
Sorry,
had her hand up.
didn't see your hand.
This is for Ivana. You mentioned in your report that you're increasing the rent budget. Has the rent in Lincoln Square gone up?
So we have our new lease stated to be at $1,000 a month. And as of right now, we have it at least until December. And the reason for that is because after speaking with Danielle, we were not entirely sure what our move was going to be at the end of the year. But as far as we got in our conversation was that I should at least re-sign for the minimum of 6 months. And given that that is the case and that I may have to re-sign for another 6 following that, that's why that number is at 12.5. A little bit of padding in there just in case we need extra for the utilities or anything, given the fact that they were very incredibly late when giving us the utility bills last year. So we had really no idea what the estimation for our utility bills was going to be until the end of the year when we received about 7 of them all at once because the landlord just forgot. So it was a little hard to estimate there. That's what that extra padding is for, but that's why it's that 12.5.
That makes sense. And you could sort of answer my follow-up question about if the 2 offices would be joining back together at some point, and if so, when, and how does that look like? I know you talked about facilities and infrastructure a little bit, but thank you.
I think we met, and it's our intention long-term for the township to co-locate. So all under one roof, preferably, and certainly we're always looking to save, kind of have the most efficient approach.
Any other questions? Sharice.
Danielle, with SSI recipients, What are the restrictions when you get SSI? Can a SSI person have a part-time job or any kind of job or anything? That's what I want to understand.
Yeah, so, yes, a person who, so essentially, this is like the short version of the story, is that, a person is eligible for SSI if, whether they've made any income or not in their life. If you get SSDI, which is a larger amount of money if you have at least 10 service years, work years, right? But if you have less than 10 work years, then you're eligible for SSI. And essentially, the idea is that you are not able to make the poverty level wages, which the last I checked was around 1,200. I mean, there's been adjustments this year, I'd have to look. But if you basically are not physically capable of making that poverty level wage, then be due to a disability that's medically verifiable, and that's an important one when it comes to fibromyalgia and some of these other things where chronic pain issues. But if it's medically verifiable and you're able to make a case and you're able to show over a period of time that you attempted to work, were not able to work, you've been out of work for a long period of time, there's a whole set of things that they look into. But essentially, then you could qualify for partial or full SSI. So if you're able to work, you may receive a partial SSI payment. We don't see those very often, I'll be honest, but it is possible. Or you would get a full SSI payment. We do work with the Department of Rehabilitation Services, and we've been really trying to strengthen our relationship with them because they are meant to work with people with disabilities who may have some level of fitness for working. And so if someone is denied SSI, they have a medical verification. I mean, if we're submitting their application, they definitely have medical verification. Usually somebody is denied. I mean, honestly, they're almost always denied, and we tell people that up front. Then we may go to DOORS, and they may work with DOORS, and then DOORS will attempt, that's a form of government, to try to help them work. And if they're not able to work with a DOORS coach or a counselor, that's another thing that helps to prove to the feds, to Social Security Administration, that they're not able to work, right? So it's really a process. Honestly, the most important thing about disability applications is that people document their disability, and they document their disability by going to doctor regularly and going to specialists and following up. So our office really helps people, and we are going to have an outreach vehicle, which would be very helpful to this, where we can help to accompany people to their medical appointments, et cetera. I just met with Ava and Sina, and they, to try to get to have specific times on Sundays when we could bring people to kind of help get into the system if they haven't doctored for a long period of time. So we work with Carl, we work with the local clinics, we work with Francis Health Center, whatever they're called, Promise Healthcare now, to basically see if we can establish a record of doctoring. That shows you how old I am, just for the record. Francis Nelson was my healthcare provider when I first moved here. So, to help them doctor so that we can help them prove their disability to the Social Security Administration. And I would say the biggest barrier to that is being able to get into doctors, but also to overcome medical trauma and people's fear and what they've experienced in the past. And so, we're working on that piece.
I'm sorry, just one more question. Is there a cap that someone on SSI can make, and is there any chance of that poverty level being raised? $1,200 doesn't sound.
Yeah, it's not much.
I mean, that's like.
Each year, the poverty level is set by the federal government. And so it does raise over the time, and when there's inflation, it raises more. I think it's important that if somebody is experiencing a disability and they also feel that they're able to work, and think about it, if you are disabled and you don't get SSI, you have no income. So you kind of need to figure out how you're going to bring in income and work. I really recommend that people work with either our township if they're living in Urbana, or work with the Department of Rehabilitation Services. I really think that they can help guide that process of helping people work to the level that they're able to. Some people can work very part-time, And that allows them to bring in some income while they're also applying for a disability.
So they don't have a cap, is what that's the other question.
There is a cap, and I don't want to misspeak it,
Okay.
but I do know that there's basically, it's understood that they're not making more than the poverty level,
Okay,
is my layperson's understanding of it.
okay, thank you.
Thank you. Well, we have an ordinance on, motion on the floor for approval of the Cunningham Township annual budget for fiscal year 2024. Will the clerk please call the roll?
Ms. Wu,
Yes.
Mr. Evans?
Yes.
Ms. Hersey?
Yes,
Ms. Colacetti?
Yes.
Ms. Bishop?
Yes.
Mr. Quisenberry?
Yes.
That motion passes. Last item under new business, ordinance number T 2023-08-003, which is an ordinance approving the Cunningham Township annual budget for fiscal year 2023 revised. And we have a note from Danielle, you just want the council, the board to put this on file.
Yeah.
Is that correct?
So I know this is confusing because you just passed the budget for 2024, and I'm asking you to put a revised budget for 2023 on file. But because we've been growing so quickly, the last few years, we've had to do this where the amount of changes within line items, and it's almost entirely due to new grants and growth, is greater than the 10% cap, and therefore you have to do an amended budget. So essentially, I'm just asking you to take our actual numbers. We've closed the books and given them to the auditor. So this number is the number, unless the auditor, requests changes for the end of the fiscal year. These are the actual numbers before you. And we just want you to put it on file. The clerk's office will notice our public hearing, and then we'll have a final vote next month. And that will be before the end of September when we need to have the revised budget.
Okay. So we're looking for a motion to put the fiscal year 2023 budget on file.
So moved.
second.
I'll give that to James this time. Moved by Mary Alice, seconded by James. Discussion. Okay, will the clerk please call the roll?
Ms. Wu,
Yes.
Mr. Evans?
Yes.
Ms. Hersey?
Yes,
Ms. Colacetti?
Yes.
Ms. Bishop?
Yes.
Mr. Quisenberry?
Yes.
That motion passes. With no further
Wait,
business.
wait,
Oh, Mary Alice.
may I say something?
Yes, you may.
So I've spoken to a couple of you, but my plan is, after the clerk tells me the proper procedure, to propose that we start the town board meetings at 6:30 instead of 6. So I just want to give everybody a heads up that that will be coming in a resolution or something next meeting.
Thank you for the heads up. With no further business before this board, we stand adjourned, and the city council meeting will begin at 7 p.m. Thank you very much.